I'm Dr. Gilbert Ross of the American Council on Science and Health with good news and bad news about smoking rates. The good news is, in 2007, U.S. adult smoking rates dropped below 20% for the first time in years. There are now more former smokers than current smokers. Slightly more people are being advised by their doctors to quit, and women's smoking rates declined for the fifth year in a row. The bad news is, there are still over 43 million adult smokers in the U.S., and the decline in teen smoking has leveled off. Cigarettes still kill well over 400,000 Americans each year, and slightly fewer people reported even trying to quit in 2007 than in previous years, possibly because approved quitting methods work so badly, hovering around the 20% success rate. There are ways of quitting cigarettes even while continuing to receive nicotine. One way is substituting smokeless tobacco products for cigarettes. Unfortunately, federal health authorities tend to dismiss the huge difference between the risks from smoking and the risks from smokeless, which are real but less than 1/10 the risk of cigarettes. It's no surprise that government mishandles the issues of smoking. Take, for example, the so-called Master Settlement Agreement of 1998, in which tobacco companies agreed to pay state governments $246 billion over 25 years, supposedly to combat health costs from smoking. But a new report says that governments have spent only 3% of that money on smoking-related issues. Similarly, a recent attempt to put cigarettes under the oversight of the FDA probably wouldn't have had much impact on public health, but would have had the unfortunate effect of making people think that cigarettes are now FDA approved. Still, the U.S.'s efforts to fight smoking at home look like a shining success compared to the problem overseas, where millions in countries like China and India will face a wave of disease and death in the decades ahead from high smoking rates. That's a tragedy that threatens to dwarf the little bits of good news here at home. Learn more at ACSH.org and thescooponsmoking.org.